Hi, good afternoon, and welcome to the South Dakota Healthy Nutrition Collaborative's Lunch and Learn webinar series. As a reminder, the purpose of the collaborative is to provide a collective voice to support access to nutritious food, which brings a strong foundation for healthy South Dakota families and communities to prosper. Our three goal groups, our areas of focus, are to improve coordination, identify areas for statewide research and evaluation, promote programmatic best practices, to elevate the voices of food nutrition advocates, researchers, and individuals experiencing food nutrition insecurity, and to advance policy implementation to improve food and nutrition security in South Dakota. And with that, I am going to introduce Nick, and Nick, you'll have to pronounce your last name for us. From Feeding South Dakota, he is the new Community Program and Partnership Manager. So welcome, Nick.
Thank you very much. And it's Nick Cerritas, for anybody who is curious. Thank you very much for allowing me to be a part of this and sharing information all Feeding South Dakota. So I will go ahead and share my screen here. And I'm doing the right one now. Does that look right?
Flip the screens because we can see your notes.
I am terrible. I'll figure it out one thing. Nope, I just did it again.
They look great.
Okay. First time, right? First time. So like was said, my name is Nick Cerritas. I'm the Community Partnership Manager here at Feeding South Dakota. Essentially what that breaks down to is I have 6 community partnership coordinators underneath me that service all of our partner agencies across the state. So I have 2 here in Sioux Falls. I have 2 in Pierre at our warehouse in Pierre, and I have 2 in Rapid City. So the state itself, we've essentially kind of cut it up so that each one of my coordinators has effectively around the same amount of agency partners that they manage. Now, one of my coordinators is actually his actual title is he's the tribal coordinator. So he actually has agencies on all of the reservations across the state of South Dakota. This was brought on, and I'll get into it a little bit later because of the 104 collaborative. But that is my job is to manage my team, and my team's job is to build the relationships across the state with all of our agencies to truly understand what is going on in the communities and how we can better serve each one of the communities across the state. So food insecurity versus hunger. Our work at Feeding South Dakota is centered around food insecurity, and it's an environment that's constantly evolving. Food insecurity, often referred to as hunger, is actually defined by the USDA as a lack of consistent access to enough food for every person in a household to live an active, healthy life. This can be temporary, or this can be a long-term ongoing problem. Excuse me. Food insecurity can have a wide impact depending on someone's circumstances. From your background, you may see parents skipping meals so that kids can eat, seniors choosing medication over healthy food, others working full-time but can't stretch their paycheck to cover all their household expenses. So they choose to pay an electric bill instead of having a meal. When people don't have enough food or choose inexpensive foods with low nutritional value, it can then lead to chronic diseases, impact the child's ability to learn, impact work performance. And once that cycle of poor diet and poor health begins, As we all know, that's one of the hardest things to break. So who we are is Feeding South Dakota. This year, we are celebrating our 50th year as Feeding South Dakota. Feeding South Dakota is the state's largest hunger relief organization. Our work is supported by 3 distribution centers. So we have, again, one here in Sioux Falls, we have one in Pierre, and then we have one in Rapid City. Through our programs and agency partners, we provide food in all 66 counties, fighting hunger in rural communities, metro areas, and on the Native American reservations. Our vision is a state where no one person's health, well-being, or potential is hindered by the availability of nutritious food. The map that you are looking at, the way it's divided up, is how our warehouses service the various counties across the state. So you have in the yellow, that's all serviced by the Rapid City warehouse. The orange is the Pierre warehouse, the green being the Sioux Falls warehouse. So this year we have the privilege of acknowledging our 50th year, which is super exciting. We began as a food pantry in Sioux Falls in 1975 and a food bank in Rapid City in 1983. It has since evolved into a statewide organization that continues to provide hope and nourishment for our neighbors facing hunger, no matter what the situation is. For over 5 decades, we have reached countless families, children, and seniors, and navigated a global pandemic by working alongside generous donors, corporations, volunteers, and community partners. We are grateful to be trusted with this work, and just as we honor our past, we also commit to our vision of the future where no one in South Dakota goes hungry. If you want any more information about our 50th anniversary, you can always go to our website. There are links there about background, our history, and what we're doing. So this is the big one that is always the eye catcher for me. Every year, Feeding America comes out with something called Map the Meal Gap. And essentially what it is a breakdown of every county in every state across the country. And they look at the food insecurity in each one of these counties. According to the Map the Meal Gap study that has just come out, hunger exists in every single county in our state, ranging from the lowest at 8.5% in Hanson County, all the way up to 28.2% food insecurity in Oglala, Dakota County. Our state has an overall food insecurity rate of 12.4%, which is an increase over last year. Basic contributing factors to that, as we all know, it all kind of bases on the economy, inflation, we have the expiration of pandemic benefits. All those contribute to the rising food insecurity in the state. So what do those numbers actually tell us? In South Dakota, there's about 113,750 individuals who are food insecure. That comes out to about 1 in 9 adults across the state. 1 in every 6 children, however, don't have access to food they need. And that's the one that's scary. Again, this is a study that's done every year by Feeding America, excuse me. And as you see on the bottom where it says Map the Meal Gap Study 2025, it's 2023 statistics. Because they do the whole country, they're always behind. But I can tell you what we see as a food bank and as Feeding America as a whole is that although these numbers stand where I just told you today, we are seeing an increase last year and still an increase this year in those numbers. So we project when Map the Meal Gap comes out in the next coming years, those numbers will just still continue. So how does Feeding South Dakota operate? So this is kind of a basic look, breakdown on how we source, store, and distribute the food. So food and funds are received by Feeding South Dakota from various methods. 90% of the food Feeding South Dakota receives comes to the Sioux Falls warehouse, which is the largest of our 3 locations. Our team then sorts and transports the food to and from the Pier location and the Rapid City location as well. Volunteers are one of the main essential points in all of the work that we do. We have multiple shifts a day, many shifts each week at all 3 of our distribution centers. Their job is they sort the food, they pack the food, they help get the food all ready for us to load it on the trucks and send it out either to our other distribution centers or to our agency partners across the state. So our team is on the road every single day. Millions of pounds of food go out each year. Last year, the number of miles traveled equated to traveling around the earth 14 times. So that's including everybody from our Sioux Falls site, our Pier site, and our Rapid City site. So this just goes in with our core values, which are when we serve with compassion, we preserve dignity and reserve judgment. We work with a purpose, so we work with consistency and operate with integrity. And we connect with intention, assuring teamwork, encouragement, and community. Our food sources. So where does our food come from? As far as poundage of food goes, last year, or for year 23 and for year 24, we distributed approximately the same amount of pounds. So you're talking about 14 million pounds of food. Where does that food come from? So as you can see in our split, the USD nutrition programs, which would be your TFAP foods, CSFP, which is like the senior box program, they equate to about 31% of the total pie. This is actually a 69% increase over last year. The big thing to remember is that this food is all federally funded, and you do have to meet certain requirements in order to receive this food. Our donated piece of the pie at 6%. This is a 71% decrease from last year. So this would be your food drives. This would be the bags that the mailmen will hang out each year for you to put canned foods in. Those are our donated products. Again, down 71% from last year. Then we go over to our purchase product, 23%. The 23%, this is a 14% increase from last year. So as you'll see, the remaining 2 pieces of this pie are both increases. Obvious when we have such a drastic decrease in the donated product that's coming in, obviously the other pieces do have to increase. Feeding America at 24%, that's a 22% increase from last year. So what that portion actually is Feeding America has partnerships with a lot of the higher level organizations in the country, meaning like Tyson Foods, Purdue Farms, things like that. So those bigger organizations donate food directly to Feeding America. And then Feeding America we have a gentleman on staff who actually goes onto a Feeding America website and bids on this food. So it might be oranges from Florida, it might be chickens, it might be, you never know what it's going to be, but excuse me. When I say 24% from Feeding America, that's what that portion is. They're the bigger truck shipments from those bigger organizations that we put bids on. And then that last portion, 16% of retail rescue, that is also a 24% increase from prior year. Retail rescue is technically donated product as well, but we separate it out because it's a little bit different. Instead of you just doing a food drive and putting cans of food in there, what retail rescue is something like here in Sioux Falls, we have Hy-Vee. Hy-Vee has food that say they're bakery products. 99% of the time, After the day is done, they would just take their bakery stuff, throw it in the garbage. Well, instead, they donate that type of product to us. So that retail rescue is us going to your Hy-Vees, your super Targets, your super Walmarts, even all the way down to like your quick start convenience stores. They will donate things to us, and then we either go and pick them up and bring them to partners, or we have partners with the capacity to actually go to some of these retail locations and pick up the food themselves and bring it to their place. This is very, very helpful in more rural areas where we obviously don't have trucks. So our work overall last year, like I said before, approximately 14 million pounds of food distributed. That works out to being about 11.7 million meals provided. Our main thing that I always like to highlight here is the volunteers. 10,182 volunteers gave 58,983 hours of their time. That is equivalent to 28, a little over 28 full-time employees over the course of a year. Obviously, our work cannot be done without the help of the volunteers. And then this part on the bottom, 78% of foods distributed encourages a healthy diet. So foods to encourage, it's not just any food going out. We are ensuring it's nutritional to meet the needs of our neighbors to help them thrive. We had a goal last year of 75%, and we're at 78% last year. And if I'm not mistaken, we're even higher this year. So that is very, very important to us as we focus on not just getting food on your plate, but making sure it's healthy and nutritious. So I'm just going to highlight some of the programs that Feeding South Dakota has as a whole. Our main one that I'm sure everybody has seen is our mobile distribution program. We have 1,405 mobile food distributions hosted over the course of a year. We have 106 locations each month in 104 different communities. They receive an average of 45 to 55 pounds of food with a mix of non-perishable, refrigerated or frozen, sometimes both, and produce. So at these mobiles, anybody who is food insecure that is coming through our mobile can visit these once each calendar month, and they must qualify for the income guidelines under the Emergency Food Assistance Program. So that is the TFAP program that is federally funded. The reason for this is because aside from donated product that we may have on these mobiles, a lot of the food is federally funded TFAP. So this program continues to trend with a month-over-month increase in families served, 20% higher than this time last year. Our child hunger programs. So we have two different types of child hunger programs. We have our backpack program and we have our school pantry program. Last year, we served 164,699 backpacks to students during the school year and summer months. 620 students served monthly through our school pantries. Our backpacks themselves, so we have 85 schools, that we partner with that we deliver backpacks throughout the year. Almost every single one of these is weekly. We have a couple in the central part of the state that we do bi-weekly, but for the most part, they're all weekly distributions. These backpacks are filled with non-perishable ingredients that are easy to use for children. When we pack these backpacks, we keep in mind that a lot of these kids don't have parents home with them when they need to eat this food. So we make sure if there's a can in there, it has the easy pop top. It's all foods in there that kids are familiar with and are very easily made if it's like an Easy Mac or something along those lines. Otherwise, you're going to see granola bars, maybe beef sticks, fruit cups, things along those lines. all of the food that goes in these backpacks are purchased from us. Nothing is donated that goes in these backpacks, and they average about $6 per backpack when it's all put together. Our school pantries, we focus more on middle school, high school to put the pantries, because obviously elementary school a little bit harder for the younger kids to grasp what they should be grabbing in a pantry. But they're all conveniently located on school grounds, whether in the school or right outside of the school. And it offers a reliable food source, not just for the student, but for the family as a whole. So we don't limit it to the kid coming in and only the child being able to get food from the pantry. It's open for the families to come in if they have the time to actually get food from the pantry as well. Wellness pantries. So our wellness pantry program is actually a program that's really starting to become something now. Prior to this year, we had a wellness pantry in Rapid City. We had one in Yankton, and we were just beginning to start one here in Sioux Falls. We didn't actually have a program around it. It just happened to be that they were in healthcare facilities. So our wellness pantries support the idea that food is medicine. It helps with a focus on helping to fight nutrition-related chronic diseases like diabetes, hypertension. They are located within medical clinics and provide immediate access to nutritious food for patients who screen food insecure at time of appointment. Currently, we have 6 wellness pantries and are in the process of adding 2 more to open this year. Like I said, we have Complete Health in Rapid City. We have Horizon Healthcare in Yankton. We have Sanford's Kids Kitchen here in Sioux Falls. We have what has been coined Sanford's Kids Kitchen 2.0, but it's actually the maternal medicine ward here in Sioux Falls. We have the Avera main campus in Sioux Falls, and we have Avera in Parkston for our current locations. So last year, we were able to help serve 18,728 people through our wellness pantries. Obviously, with the addition of 3 more just this year, with 2 coming probably before the end of June, we're expecting that number to rise quite drastically. And before I go on to this, I want to add a little point that with our wellness pantry, it's not just about getting them what we call an emergent bag of food, which is when they're leaving, making sure that they have their next couple of meals in hand with them. But it's also giving them the resources so they know what is available in the community, so that it's not just the 2 things and it's good luck. It's, hey, call 211. It's, here's a list of the mobiles in the area. Here's a list of pantries available in the area for other resources to find help as well. Our senior box program. So this is also one of those federally funded programs. You may hear it referred to as CSFP, but in the end, it's the senior box program. Last year, we were able to distribute 27,929 senior boxes. This program itself, we don't have any, how do I say it? We don't get to choose how many seniors we can help through this program. The USDA allots X number of senior boxes to a state. The state then partners with an organization and says, this is how many boxes that you're allowed to give out each month. So we are the main, we are the only senior box partner with the state. We cover the whole state. We're not in every community because, again, we are limited by a certain amount of boxes that we are allowed to send out each month. To be eligible for this program, You must be 60 plus at time of application, and you must meet certain income guidelines. The food items in the box are shelf-stable groceries that serve approximately 25 meals. The food items are designed to meet the nutrition needs of the age group, and it does include nutrition information as well as recipe cards on how to prepare certain meals with the food that's in the box. Our community partners. So our community partners, which we will also, and I say all the time, our partner agencies, they're the ones that are serving those facing hunger in their communities directly, whether it's small town food pantries, shelters, youth programs, hot meal sites. They're really just an extension of us, but they're the ones that know what's going on in their community. As a Feeding South Dakota partner, what we offer them is they have access to our shopping list. They can come on to, we have a design program that they can go on and effectively shop off of our shopping list. And then we will deliver the food out to them so that they can get it out to their community. We try to make sure we have agency forums at least a couple times a year to address any raising concerns. But overall, this is what my coordinators, this is their most important task, is building the relationships with our community partners around the state to truly better understand what is affecting them in the now, so that they don't have to wait 4 more months for a community forum to pop up so that they can address their concern at that. Because as we all know in the state of South Dakota, what's affecting us in Sioux Falls is not affecting, it might be completely different from what's affecting the food pantry here in DeSmet or what's happening up in Bison in the corner of the state. So that's where my coordinators come in to make sure that everybody at Feeding South Dakota is always up to date at truly what is happening in our community. And then the strategic work of Feeding South Dakota, our mission to end hunger and our vision to help our neighbors reach their full potential. As we look to our future, we will build our strengths and the strengths of our communities we serve to meaningfully advance this mission. So the first one is community-led solutions. What does that mean? So we believe that local organizations providing food access in an especially effective model is an especially effective model because our partners know the needs of their community members and can provide food on a consistent and ongoing basis. We are committed to investing in the capacity of our partners. So this is kind of a turn from prior where Feeding South Dakota was more reactionary than being on top of things and trying to make sure that we were actually listening to what our communities around the state were saying and what their actual needs were. The second point here, equitable access. So when people have the resources they need to thrive, so do their communities. Rural and farm communities have the unique challenges that make accessing food far more difficult. Food insecurity in rural areas of South Dakota is twice as high as in metro areas. And as well, many of us know when you travel around the state, you might go an hour to 2 hours before in between seeing grocery sales. There are some communities where the only grocery store in the town happens to be the convenience store, or in some situations, a Dollar Tree. Now, I'm not knocking either one of those, but the access to then nutritious food becomes very, very limited, and the cost of that food ends up being much greater. Third point here, advocacy. So there's not a one-time solution for ending hunger, and we recognize that to truly make an impact, we need partnership with our state and federal government. So this is constantly working with our legislators so they better understand what is happening from a food insecurity standpoint across our state. But we have to constantly remind ourselves, as we might get aggravated when we see decisions being made, is we are the experts in this field, which is why we do it. But if we're not sharing that expertise, then it's kind of on us because we're not taking the time to educate the people that are actually making these decisions. So whether it is our CEO or our VP of Public Relations, whether it's working with Jennifer on advocacy with the state, we're constantly looking at ways to better educate the people that are all the decision makers so they can make educated decisions instead of just making decisions that they believe is happening. And then innovative partnerships. So we are strategically positioned to respond to the needs of today and meaningfully advance our mission in the years to come. So we are part of the first statewide collaborative focused on access to nutritious foods, the South Dakota Healthy Nutrition Collaborative. And the second part, which I referred to earlier, the 104-degree West project. So what this is it's a multi-state initiative to support Native American communities with food access. So the food banks of South Dakota, North Dakota, Montana, and Wyoming have been working together for the last couple of years to better understand how we're all working to get food insecurity rates on on the Native American reservations lower. Obviously, we know every reservation is a little bit different, and every state and how they can handle it is a little bit different. But what has come of this is it's hard to put into words. The gentleman that's on my team, that is the tribal coordinator, when he first started in the position, he was met with a lot of closed doors and non-return phone calls. Fast forward 2 years, and he's being invited to Buffalo Harvest. He's being invited to powwows. He's actually being invited to when the senior leadership on councils on these reservations are meeting and trying to make decisions on how to better affect their tribes. He is being brought in as a voice on the food insecurity side. So what we've seen from this collaborative is doors have been reopened for us because we took the time to listen. And then as always with Feeding South Dakota, there are many ways to give, whether it's funds, whether it's donating food, whether it's volunteering, or just being an open advocate for us. Obviously, not everybody has the money. Not everybody has the ability to donate food, but as you saw before, one of the most important things in our organization is volunteering. Coming in for a 2-hour shift and helping us pack bags is one of the most important things that can happen with Feeding South Dakota. And that one at the bottom there, advocate. This is probably, as I became an employee of Feeding South Dakota, I realized I knew far less about not only what Feeding South Dakota was and did, but what food insecurity truly was in the state of South Dakota. And this has driven me to become a very loud mouth amongst my friends to turn them into advocates for us as well. Because what I was able to learn was mind-blowing to me. Because again, if you're not in the field and you don't do it, you don't really understand or see the numbers. And now that you do, as we all know, it's eyeball. And then last but not least, the many different ways to connect with us. We do have, as you see on the bottom, a new weekly podcast that is put out. The interviewees on this podcast range everywhere from people from Feeding America to some of our staff and what they do, to our agency partners across the state and what they're seeing as a major issue in their communities. Highly recommend watching it if you haven't yet. Obviously, you don't have to watch all of them, but they're very, very informative, and they're good to have on in the background or in the car when you're driving. So with that, I will stop sharing my screen.
Hi, Nick.
We'll get
Thank
back
you
over to
so
Jennifer.
much. Yeah, thank you so much. I'm going to go ahead and stop the recording now, and we can take some questions from the audience.